start with the physical effects of cancer. The nausea, weight loss or weight gain, the physical pain, and fatigue. But what about the non-physical side effects? What about what cancer does to the brain? As a neuropsychologist at UAB, I'm studying the effects of cancer and cancer treatment on cognitive function. As a clinician, my patients come in with complaints of cognitive functioning. They survive the treatment, they're like 2 years post-treatment, but yet they're still having difficulty functioning at work and in the community and at home because of these persisting difficulties. My American Cancer Society grant right now is looking at patients with advanced cancer and how it affects their everyday functioning. So what we have found is that patients with advanced cancer, due to their cognitive impairment, have significant difficulty making treatment decisions. This is important because they're faced with a multitude of decisions regarding whether to have surgery, whether to have radiation, what type of radiation, whole brain, focal radiation, what type of chemotherapy, whether to engage in a clinical trial that might not be FDA approved, whether to have homeopathic medicine, or whether to just say, I'm not going to get any treatment. So our research that's sponsored by the ACS is helping improve communication between physicians and patients and their family members to help treatment decision making. Other areas of research that ACS is helping to support is looking at better ways of detecting cognitive impairment. So many of our tests that we have now are not able to detect the sensitive changes that occur in cognitive impairment related to cancer and cancer treatment. So there are newer techniques using cognitive neuroscience tools that we're able to leverage and would be able to more precisely pinpoint the exact areas of cognitive impairment so that we can intervene and we can help these patients improve their quality of life. And that's exactly what we're doing. And treatment, I would say, is imperative. Without it, you won't survive. So we just want to mitigate the effects of cancer. So we conducted a study at UAB that looked at a computerized cognitive intervention with breast cancer survivors. And we found over 10 weeks significant improvements in their processing speed and attention. This is just one example of a way that we can help improve survivors' ability to function and reintegrate and return to their normal level of function in their daily life. And I can't thank you all enough. Without the American Cancer Society, this research would not have occurred. I don't know if I mentioned I'm a recipient of a grant from the American Cancer Society. It's funding a 5-year study that has helped propel all this research, and it is making differences in patients' lives, and I appreciate it so much. Thank you for the invitation to speak.